we've been doing a lot in the last few years identifying complex trauma in children as well as in adult survivors. And the definition of complex trauma is trauma that occurs very young in age, often in the early years of life, having to do with a problematic attachment with caregivers. And that sets a child up for other episodes of being abused or bullied or set up. And complex trauma is defined as repetitive trauma over the course of childhood that really impacts developmental epochs. It can happen in the home, it can happen outside of the home, and children have a fairly predictable way of responding to it. But the problem is many mental health professionals don't ever ask about a history of trauma or don't ever identify attachment or relational trauma at base of some of their clients' problems. We also know at this time that there are a number of treatments that are available. In fact, 2 years ago, Julian Ford and I published an edited book called Treating Complex Trauma in Children and Adolescents. The treatment is very much like what we provide for adults, but at a developmental level that the child can accommodate. And the sooner the child gets treated, the better, because it can offset a wide variety of problems, some of which can last a lifetime. It also became obvious that the context of the child was very important, and family members, parents, siblings, and school settings needed to be involved in the treatment because those are the places where children spend a great deal of their time. Unfortunately, what often happens to these children without attention to the possibility of a history of trauma is they very often get referred for treatment, and they get diagnosed as either ADHD or conduct disorder, oppositional defiant disorder, and then they get medicated for it. And so the real rule in terms of working with children that are behaving in a way that's different is behaving in any of these ways is to really try to find out if there were adverse events that preceded the development of these symptoms and conditions. Trauma in our society has recently, in the last number of years, been identified, and we understand something about post-traumatic stress disorder, but we very often don't understand what happened to the individual and how they understand it. And even in working with children, I often refer to the fact that we need to go back and identify and talk to what I call the child part of the mind, the child mind, because that's how they made sense of what happened to them. And children make sense according to their developmental level, and the way that they make sense can be a lifelong problem for them because the child's logic doesn't necessarily agree with adult logic and can cause them to have places that they misidentify the causation, they misidentify that it was about them, and those create problems in their own right.